everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about another congenital heart disease, which is transposition of great arteries. Now, this is a condition where, from the name itself, we can understand what it is referring to, right? So, transposition means switching or swap, right? And what it is saying, transposition of great arteries, that means switching of great arteries, right? Now, if we see the great arteries, we have two major arteries that is coming out of our heart. So the first one is pulmonary artery, which goes to the lungs, which carries the deoxygenated blood to the lungs for for oxygenation. And we have aorta, which takes the oxygenated blood and push it to all over the body. So these are the two major arteries that we have. So basically, transposition of the great arteries is something that is basically saying that where the pulmonary artery should be there is the aorta, and where the aorta should be there, the pulmonary artery is there, right? So that means these two large arteries, these two great arteries have switched their position. Well, what we mean by, these two great arteries have switched their position. So for that, we need to look at the normal heart. Now we know that, the pulmonary artery is connected to the right ventricle, from where it takes the deoxygenated blood and then send it to the lungs, right, for oxygenation, right? So basically, this pulmonary artery carries deoxygenated blood, and that's very important to remember. And then next, the aorta, which is connected to the left ventricle. So basically, this aorta is connected to the left side of the heart, from where it takes the oxygenated blood and then it sends to all over the body, right? So that is what, that is how it is connected in the normal heart. And from this, what we can understand is that the right side of the heart controls the pulmonary circulation, because, it's sending blood to the lungs through the pulmonary artery, right? And it's carrying deoxygenated blood. So basically, the right side of the heart is controlling the pulmonary circulation, and the left side of the heart is controlling the systemic circulation, because that is sending the oxygenated blood to the to the body. But in transposition of great arteries, what is happening, as we are saying that they have switched their position, that means the aorta is connected to the right ventricle instead of to the left ventricle. So basically, the aorta is connected to the right ventricle, and the pulmonary artery, which is supposed to be connected with the right ventricle, is actually connected with the left ventricle. So what we are saying is that both the arteries are present in the heart, but what has actually happened, that their position, their location have, it's switched. So where the pulmonary artery should be connected, the aorta is connected, right? And where the aorta should be connected, the pulmonary artery is connected there, right? So that is what has happened. So if we look at the normal heart, we would see that the right side of the heart and the left side of the heart work in a series, right? And if in transposition of great arteries, what happens, this does not work like that, right? So what happens, the pulmonary circulation and the systemic circulation works parallelly. That means they are not working in a series. So there is no communication between these these two circulation, or the right side of the heart or the left side of the heart doesn't have any sort of communication. So we need to understand that, how does the blood flows when these two major arteries will switch their position. But to understand that, it's very important to know about the normal blood flow of the heart. So how does the normal heart function, right? So we have four chambers in our heart. That's the right atrium, right ventricle, left atrium, left ventricle, right? Now, what happens? The deoxygenated blood comes to the right atrium from superior vena cava and inferior vena cava. Now, from this right atrium, it goes down to the right ventricle through the tricuspid valve. And once this deoxygenated blood is there in the right ventricle, the right ventricle will push the blood to the pulmonary artery through pulmonary valve. And from this pulmonary artery, the blood will go to the lungs for oxygenation. So there the gas exchange will occur and the blood will get oxygenated. So once the blood is oxygenated, this oxygen rich blood will enter the left atrium through pulmonary vein. Right? Now from the left atrium, where it will come down to the left ventricle through this bicuspid valve. And then from the left ventricle, this oxygen-rich blood would go to the aorta through the aortic valve, and then from the aorta it would be sent to all over the body. So that's how it works. That's how the normal heart works, right? And what we can see here, that it's not like, the right side of the heart and the left side of the heart is working parallelly, because it's working in a series. The deoxygenated blood is first coming from the right side of the heart to the lungs, and then from the lungs it's coming to the left side of the heart, and then from the left side of the heart it goes to the body, right? So this is a series, right? So that's how it works. But now in transposition of great arteries, what happens? However, the deoxygenated blood would come to the right atrium from the superior vena cava and inferior vena cava. And then from the right atrium, this deoxygenated blood would come down to the right ventricle through the tricuspid valve. And now here we have the problem, right? Because in the normal heart, we saw that from the right ventricle, our pulmonary artery is connected, right, with the right ventricle. So through the pulmonary valve, it goes to the pulmonary artery. But here there is a problem, right? So here what would happen? From the right ventricle, this deoxygenated blood will be pushed through the pulmonary valve, but it would enter the aorta, because the aorta is connected to the right ventricle, right? So there is transposition of this artery. Now, when it enters the aorta, and then it would be, sent to all over the body. So that means the deoxygenated blood, which came from the body to the heart for oxygenation, that did not even reach the lungs, but instead that is again sent to the body, right? So, and also one more thing here to notice, that now the right side of the heart is controlling the systemic circulation. But in the normal heart, what we saw, that the right side of the heart would control the pulmonary circulation, and that's how it's supposed to be. But here it's not happening like that. So here, the systemic circulation is being controlled by the right side of the heart. Now, let us see what is happening in the left side of the heart. So the pulmonary artery would push the blood to the lungs, and then from the lungs, the oxygenated blood would enter the left atrium through the pulmonary vein, right? And then from there, the oxygenated blood would come down to the left ventricle. Now, when the blood is in the left ventricle, again we have a problem, right? Because here, the left ventricle would push this oxygenated blood through the aortic valve to the pulmonary artery, because the pulmonary artery is connected to the left ventricle here. So the oxygenated blood never enters the systemic circulation, and also the deoxygenated blood never enters the pulmonary circulation. So that's what is happening here. Well, so from this, what we understood is that the right side of the heart is controlling the systemic circulation, and the left side of the heart is controlling the pulmonary circulation, and that's what is happening, right? But you might be wondering that how did the baby survive when the baby was in the uterus? Because this problem was, is present since the development, right? Since the development process. So how did the baby survive? Because baby is never receiving oxygenated blood. Now from this, what we understood is that the right side of the heart is controlling the systemic circulation and the left side of the heart is controlling the pulmonary circulation, right? Now, you might be wondering that how did the baby survive when the baby was in the uterus? Because this problem is present since the development process and the baby is never receiving oxygenated blood. So how is it possible for the baby to, survive in this kind of condition? Now, when the baby is in the uterus, we also know that the lungs aren't functional, right? So the blood has to bypass the lungs, and as the baby receives oxygenated blood from the placenta, from the mother through the placenta. So there is basically, there is no need for the blood to go to the lungs as the lungs aren't functional. So what happens? There are several adaptations or shunts which are present in the heart, right? And these adaptations are there to, help the blood to be pulled away from the heart or from the lungs, right? So that's how, it functions. That's how it bypasses the lungs. So the blood basically bypasses the lungs through these adaptations. So let us go back and remember what were the shunts or adaptations which were present in the fetal heart. So the first thing that we remember is foramen ovale. Now, where the foramen ovale is present, can you remember? So the foramen ovale is present between the right atrium and the left atrium, right? So that the blood, the oxygenated blood which is entering the right atrium through the placenta from the mother can be sent to the left atrium, and then it can be sent, it can enter the systemic circulation. Now, what this ductus arteriosus does? So basically, this ductus arteriosus connects our aorta to the pulmonary artery, right? So that means, it allows blood to flow from the left side to the right side of the heart. And these are present, in the fetal heart. So that means when the baby is inside the mother's uterus, the time these structures are present, which is necessary. But we also know, we have learned that after birth, these structures closes off, right? In few days or few hours, these structures closes because there is no need of the structures anymore, right? So what happens for the pressure change? Because a lot of things, a lot of changes happens, and due to those changes, what happens? Due to the pressure changes, these structures closes. And that's how it should be, because if these structures are present even after birth, then it would, it would allow mixing of blood. That means mixing of oxygenated blood and deoxygenated blood. So we don't need it anymore after the birth. But in transposition of great arteries, the baby needs these structures even after birth, because these structures are something which would help in mixing of blood. Now, as we saw in transposition of great arteries, that the cycle of deoxygenated blood is going on individually, and then at the same time, at the other side, what is happening? The cycle of oxygenated blood is going on, right? So there is no mixing of blood, there is no communication between both the sides of the heart. And because of that, what happens? The baby does not receive any amount of oxygenated blood. But these structures, if these structures are present even after birth, what would happen? There would be at least some oxygen which would be mixed with the oxygenated blood, which would be mixed with the deoxygenated blood. So there would be some oxygen coming in the deoxygenated blood circle. So if the foramen ovale is present, what would happen? The deoxygenated blood which is coming to the right atrium would be able to go to the left atrium through this foramen ovale. And then the deoxygenated blood can be sent to the, lungs, right? So it would get oxygenated. Again, we have ductus arteriosus. How that would help? Because the ductus arteriosus connects our aorta with the pulmonary artery. And here what's happening in transposition of great arteries, this aorta is carrying deoxygenated blood, right? So what would happen, this deoxygenated blood can drop down to the pulmonary artery, and it can go to the lungs. So if the foramen ovale is present, what would happen? The deoxygenated blood which is there in the right atrium would be able to cross to the left atrium through this foramen ovale, and that's how it would help. Again, we have ductus arteriosus which connects our aorta to the pulmonary artery, which will again help in mixing of oxygenated and deoxygenated blood. And in transposition of great arteries, the baby also may have some other congenital heart diseases which can help the baby in some way. In transposition of great arteries, the baby also may have some other congenital heart diseases which can actually help the child with this condition. Now, there are three major congenital heart diseases which can be present with TGA. So what are those? The first thing is VSD or ventricular septal defect. The second one is ASD or atrial septal defect. And the third one is PDA or patent ductus arteriosus. Now, these are the three major congenital heart diseases which can be present with transposition of great arteries. Now, I said that these diseases can help the child in a way, right? With a child who is having the condition of TGA. So you might be thinking, how does this will help? Because these diseases have their own problem. It creates their own problem, and it will again complicate the condition, right? That's what you might be thinking, but it's not like that. Now, these things can actually, benefit the child. So how, let us see first how this VSD will help. So what is VSD? Now, VSD is ventricular septal defect. So that means there is a defect, there is a hole which is present in the interventricular septum. Now, when there is a defect or there is a hole between the interventricular septum, that will allow communication between the right ventricle and the left ventricle, right? So when we know that the right ventricle is having deoxygenated blood and the left ventricle is having oxygenated blood. So if there is a communication between these two ventricles, what would happen? There would be mixing of this blood, right? So there would be purple blood. Now, we know that in transposition of great arteries, there is no connection between the right side of the heart and the left side of the heart. And if this mixing of blood happens, then it can be, beneficial, because what would happen? There would be some oxygen which would be oxygenated blood which would get mixed in the with the deoxygenated blood. Because in transposition of great arteries, what is happening? The cycle is going on. The deoxygenated blood is never entering the pulmonary circulation, and the oxygenated blood is never entering the systemic circulation. But if this mixing happens, then what would happen? Some of oxygenated blood would enter the systemic circulation, and also some of the deoxygenated blood would be able to enter the pulmonary circulation. Now, the next thing is atrial septal defect. So, atrial septal defect is the defect which is present in the interatrial septum, right? So, that allows communication between the right atrium and the left atrium. So, the deoxygenated blood which is there in the right atrium would be able to go to the left atrium through the atrial septal defect. And then we have PDA or patent ductus arteriosus, which again connect our aorta to the pulmonary artery. So that will also help again to, for some of the oxygenated blood to enter the systemic circulation. So that's how these congenital heart diseases would help a child who is presented with TGA. Well, so we understood that how would the blood, flow when there is transposition of great arteries, when there would be switching of these two great arteries. Now, let us move to the signs and symptoms. So, the first one would be cyanosis. Now, as we are seeing that the deoxygenated blood is entering the systemic circulation, that means there is lack of oxygen, and even if the defects are present, what would happen? There won't be oxygen rich blood going to the systemic circulation. These defects would allow some of the oxygenated blood to enter the systemic circulation, but that is not completely oxygenated, right? So that is a purple blood, which will be mixture of deoxygenated and oxygenated blood. So the child will have cyanosis. And remember, this cyanosis will be severe cyanosis because only some of the oxygenated blood would, enter the systemic circulation through these defects. So most of the deoxygenated blood is going to the circulation, right? So that's why, there will be severe cyanosis. And then the baby will have increased heart rate because the tissues and the organs aren't getting oxygen, any amount of oxygen, right? So what the heart would think, if it beats faster, it might get oxygen. So it would try to beat faster and try to get oxygen. Okay, so there will be increased heart rate. There will be also increased respiratory rate. Again, the condition, again, the reason is same, because there is no oxygen going into the circulation. The tissues, the cells, the organs aren't receiving any amount of oxygen. So there will be increased respiratory rate. And also, as the cells aren't receiving any amount of oxygen, there would be, poor feeding, because if you want to feed the child needs to burn out some energy, right, to take the feed. And if there is no oxygen, the child won't be, able to use that energy. So that's the reason there will be poor feeding. And if there is poor feeding, the child will have poor growth. And apart from these things, you can also see cool extremities. Again, the reason is same, because the baby is not receiving any amount of oxygen. So these were the signs and symptoms. Now moving to the diagnosis of the condition. Now, so that we understand how this condition can be diagnosed. So the first thing is ABG analysis. So if we do ABG analysis, we can, that would help us to know about the severe cyanosis which is present. And then we can also do echocardiography and cardiac catheterization. So these things would be, helpful in diagnosing this condition. Now moving to the management part. Now this condition requires surgical intervention because this is a very complicated condition. So it requires surgical intervention, but till the time they can perform the surgery, there would be certain pharmacological management. So basically, they can give alprostadil, which is a prostaglandin E. Now, how this will help? This will help to, to keep the ductus arteriosus open. So we know that how prostaglandin E will help these ductus arteriosus to remain open, that we have discussed already in the fetal circulation. So basically, we need this ductus arteriosus till the time surgery is performed, right? So to keep that open, we need to, give this medication, that's alprostadil, which is a prostaglandin E. And then the surgical management. So in surgical management, we have balloon atrial septostomy. And this is done to enlarge the foramen ovale. And this is done for temporary purpose. So this cannot help the child in long term. This would just, help in mixing of blood till the time, permanent surgery can be performed. And for permanent intervention, we have atrial switch procedure, in which basically they put the aorta where it is supposed to be, and they put the pulmonary artery where that is supposed to be. So that's how they, through this intervention, through this atrial switch procedure, they basically again switch their position. Well, so these are the surgical interventions that are there for transposition of great arteries. Now, as a nurse, we have several responsibilities in, taking care of a child with transposition of great arteries. So, basically, we have to, whatever responsibilities we have in managing a child with congenital heart disease All those things we have to do, but with that, it's very important to monitor the child closely, pre-operatively and post-operatively. So basically, as a child is having severe cyanosis, increased heart rate, increased respiratory rate, so you have to continuously monitor the child's oxygen saturation. You have to continuously monitor the child's breathing pattern, breathing rate, and how the nutritional requirement also, because there will be poor feeding, so that also you have to closely monitor. And if the child is receiving any drugs, whether there is any side effects of the drugs and all those things, you have to monitor. So basically you have to monitor the child very closely, pre-operatively and post-operatively. Well, so this was all about transposition of great arteries. I hope you have understood the topic. Thank you.